Good afternoon to all our esteemed speakers and discussants, our organizers, and our participants to this policy forum. I'm pleased to present our policy brief entitled Elections in the New Normal, Policy Insights from the Palawan Plebiscite. I'd like to acknowledge, of course, our collaborators, this policy brief, Dr. Adar Torneo of De La Salle University, Randy Catcher from the La Salle Institute of Governance, and of course, our collaborators from the Palawan State University who provided very invaluable support in the data collection, Ms. Eileen Pactao and Ms. Jacel Cerudo. So to start, the COMELEC administered the plebiscite in Palawan to decide on the proposal to divide the island into three provinces. The plebiscite provided a glimpse of the possible COVID-19 related measures that COMELEC would consider implementing in the conduct of the May 2022 general elections. So using insights generated from observing the plebiscite, this modest paper intends to offer potential recommendations that our election management body and other electoral stakeholders may reflect on about COVID-proofing the national elections. Moreover, this policy brief, using a whole of governance approach, discuss alternatives that consider supply side and demand side dimensions with the view that the current health crisis presents an important opportunity to pursue lasting reforms that can help make electoral administration not only safer but also more transparent and participatory. On March 13, 2021, the COMELEC administered the Palawan Plebiscite, which determined if the island province would be divided into three separate provinces. The conduct of the plebiscite was required by the passage of Republic Act 11259, which legislatively sought for the division of the province. With 23 municipalities participating in the polls, the plebiscite resulted in the victory of no votes or those who were against the proposal. Voter turnout was over 60%. Aside from the results of the Palawan polls, it's worth noting that the plebiscite served as the first major Philippine electoral activity during the pandemic. The poll provided a glimpse of the possible policies and guidelines that the COMELEC would implement for the 2022 general elections. The Philippine Election Body released Resolution number 10687, or entitled Revised Rules and Regulations Governing the Conduct of the Plebiscite, to ratify the division of the province of Palawan into three separate provinces. The policy guideline outlined the COVID-19 related policy guidelines that election stakeholders observed. The resolution, moreover, outlined specific arrangements in relation to conduct of campaigns, arrangement in polling places, ensuring ventilation, sanitation of election materials, medical checks, contact tracing, installation of rooms, and other safety arrangements. Post-plebiscite policies relating to health and safety were also implemented. Arguably, the COVID-19 pandemic has implications on how citizens participate in a democracy. Elections are seen as a hallmark procedure in legitimizing any democratic society. Hence, any plans to develop measures, including postponement, and rescheduling, that seek to implement new or updated electoral procedures concerning COVID-19 are met with public scrutiny. Just like most modes of democratic participation, elections are physical procedures that require face-to-face interaction. In this context, election management bodies are not only challenged to ensure that elections are free and fair, but are also safe and healthy. Citizens' perception, knowledge, and confidence about new guidelines on registration, voting, and monitoring may have implications on their actual participation, voter behavior, turnout, and the quality of the electoral process. Voting behavior may be affected by the ability of electoral bodies to credibly ensure the safety of citizens throughout the voting process. Albeit the few cases of election postponements and rescheduling, democracies around the world have adapted their electoral systems and implemented guidelines to accommodate the new normal. Of course, in non-pandemic and politics as usual situations, organizing a national election is technically and logistically demanding. Conducting synchronized elections requires large amounts of public resources, effective coordination, stakeholder support, and institutional capacity. Election management bodies are often faced with the capacity, resources, and autonomy issues. While supply-side issues hamper EMBs like COMELEC to effectively craft and implement policies, it is equally important to consider the demand side or citizens' perspective on COVID-19 measures applied in electoral administration. In this research, applying the whole of governance approach where public service delivery, like electoral management, is seen as an ecosystem of actors, interests, and institutions, as there is a need to consider demand-side inputs, especially coming from the citizens, with regard to planning, implementation, and monitoring of policies that would be developed related to the 2022 election administration. To initially flesh out demand-side inputs and stimulate policy discussions on the possible COMELEC new normal guidelines, we observed and documented the experience of those who participated, who are voters, volunteers, election workers, during the 2021 Palawan Plebiscite. The data gathered provided insights on the potential demand-side issues and opportunities that need to be considered, juxtaposed with the supply-side proposals and guidelines that COMELEC is developing. Using data generated from participant observation of the Palawan Plebiscite, key informant interviews of plebiscite participants, voters, poll workers, and election volunteers, and desk review of policy documents, we documented and qualitatively analyzed the recurring views, opinions, and observation of the plebiscite participants. Utilizing a semi-structured instrument, the questions focus on the plebiscite's participants' general and broader observations on the effectiveness, access, convenience, safety, and issues concerning the COVID-19 policies and protocols during the following stages of the plebiscite: campaign period, the plebiscite day, and post-plebiscite activities. The study covered the following municipalities: Quezon, Nara, San Vicente, Agutaya, Aborlan, Batarza, and Rojas. Data collection was conducted from March 1 to April 2, 2021. Voters deemed that the plebiscite ran relatively smoothly, and health protocols were generally easy to comply with. The caveat is that the voters only need to respond to one question on the ballot, which is yes or no. The voters expressed that the plebiscite ran effectively given the health and safety arrangements implemented in the polling place. Also, they attribute the smooth and effective implementation of the guidelines because of information and the protocol guidelines were disseminated effectively. Minor issues such as crowding outside precincts was also observed, and some voters were observed that do not have complete required PPEs, such as face shields. The protocols that were observed included the following: physical distancing requirements, sanitation of polling places and rooms, mask and shield mandates, temperature checks, use of plastic dividers in the polling booth, limitation in the number of people allowed in the polling place, separate lines or lanes for voters who experience symptoms, installation of isolated polling places for persons with symptoms. However, it can be surmised that the smooth flow of voting can be substantially attributed to the fact that voters need only to cast a yes or no vote on the ballot. Moreover, in few municipalities, crowding of people was observed outside the polling precincts, which was attributed to voters looking for information about the plebiscite process. Physical distancing measures were generally practiced during the campaigns, but of course, they were also challenged to enforce these measures in few areas. With the release of a resolution that requires limited face-to-face campaign activities, camps for or against the separation of the province utilized social media and traditional media as modes of campaigning. It was observed that physical campaign sorties, meetings in the community such as pulong-pulong, and public events were still conducted, but governed by mandates related to wearing masks, face shields, limitation in the number of participants, ventilation in the location, and physical distancing measures. While there were protocols in conducting campaigns, some participants noted that safety policies were not observed or strictly enforced in far-flung municipalities. There was also perceived non-compliance of parties to safety protocols, and this issue was used as a political and campaign issue by both parties. Supporters for and against the plebiscite proposal hurled accusations against each other that they were violating health protocols during the campaign period. Social media posts from partisan supporters called out violations of the opposing party about physical distancing rules, mask mandates, shield mandates, and crowd control. Both camps are also posted on social media allegations that the opposing party is engaged in misinformation. Intermediaries such as the church organizations, non-government organizations, barangay officials communicated the safety protocols that were implemented. Radio, TV, and social media were also modes of information dissemination. Civil society organizations using traditional and social media disseminated information about the health and safety protocols that were implemented in the polling sites. The barangay leaders were also observed reminding the voters about the safety arrangements. In some barangays, masks and face shields are being provided outside the polling place. During the post-election activities, the following were observed: physical distancing and limiting the number of people who are allowed to enter and observe the counting. While the post-election activities went smoothly, other participants claimed that some members of the media and poll watchers were not allowed to observe inside the counting area. Lastly, participants claimed that vote buying happened in their municipalities. Research respondents reported observing vote buying during the campaign period and the days leading to the plebiscite. Some of the respondents claimed that the distribution of cash in envelopes in far-flung areas resulted in crowding. So, what are some of the recommendations that we can extrapolate from the findings? One, uh, require and or promote contactless procedures or reduce physical contact during pre-election campaign activities. This may include mandates and options in the utilization of virtual and electronic platforms in all transactions and processes of the COMELEC. About the conduct of political campaigns, there is a need to adopt measures that limit physical contact, promote physical distancing, encourage the use of virtual platforms, and setting of health standards in designated campaign areas and activities. Given the recent developments in COVID-19 response in the country, the COMELEC should consider adopting policies that mandate or encourage or incentivize vaccination and COVID-19 testing of all poll workers and other election support personnel. A plan or policy to vaccinate all poll workers should be considered. During the time of the Palawan Plebiscite, vaccination, which was in its early days of rollout, was not yet required, as testing of poll workers were only limited to those who have symptoms. There is a need to extend voting hours to prevent crowding in polling places. Aside from implementing safety arrangements inside the polling place, protocols that seek to limit crowds outside the precinct should be crafted and enforced. Moreover, PPEs and other health and safety-related equipment, materials, and relevant resources should be made available and accessible to voters and all poll workers during Election Day. The presence of medical personnel should be required in every precinct. Additional support for all poll workers, particularly for teachers and other election support staff, should be provided to cover for possible hazards and exposures to potential risks. There's a need to implement a strategic, effective, and massive public communication campaign that disseminates the new normal guidelines to the citizens. From the demand side, civil society organizations, universities, schools, media organizations, and the church can serve as critical intermediaries in educating the wider public and fighting misinformation. Technology such as SMS based or online should be leveraged in the provision of information related to health protocols, the voting process, precinct locations, and other information needed by the voters, including the collection of grievances or complaints about the voting process. Integral to the new normal guidelines is the crafting of contingency plans that cover various levels of risks, including plans for a worst case scenario, such as lockdowns or possible new COVID-19 surges and other local outbreaks, with the view that elections should be free, fair, credible, and safe. The development of contingency plans should entail the participation and inputs of all election stakeholders. Adapting a whole of governance approach, meaning all relevant and interested stakeholders, including and especially the marginalized groups, should be able to participate in the planning, development, implementation, and monitoring of the new normal guidelines. Multi-stakeholder strategies allow for stakeholders to not only be participants of consultation processes, but also be active actors in co-creation and co-ownership that are important in policy changes, hence enhancing policy acceptability and legitimacy. There's also a need to establish a multi-stakeholder system that allows for greater transparency, grievance, and accountability in the implementation of electoral administration guidelines that leverages civic technology. Multi-stakeholder partnerships should be forged and promoted at every stage of governance of the new normal of electoral management. Before I end, I'd like to say that the COVID-19 health crisis presents a challenge and opportunity to reform the electoral management system in the country. Amid developing new normal guidelines, the fundamental task of the COMELEC is not only to make the 2022 general election safe, but also create an environment system that would foster voters' trust and confidence. To be able to gain the confidence and eventually active participation of the people in the next year's poll, as this policy brief asserts, there is a need to invest in mechanisms that allow citizen participation and multi-stakeholder partnership in the planning, development, implementation, and monitoring of election management policies. From a policy research point of view, understanding the demand side or the citizen's perspective on election-related policy development and governance is an insightful yet underexplored research trust. Thank you very much for listening. I'll be happy to hear the words from the discussants and to address all your questions and comments if you have. Thank you very much and good afternoon.